Hello, I'm Jennifer Wilcox, and I'm here with Health News with MediBid. MediBid is a new way to manage healthcare costs. Today, we're going to discuss how MediBid serves and benefits essentially three different groups: healthcare providers and facilities, patients seeking medical care and procedures, and employers and companies. With me today is Mr. Ralph Weber, CEO and President of MediBid. Good morning, Ralph.
Good morning, Jennifer.
How are you today?
I'm good, thanks. How are you?
Amazing.
Good.
Well, let's get right to it. Healthcare costs are not only unregulated, they're also often very much out of control.
Absolutely, yeah.
So what is the answer? Is MediBid the answer?
Okay, we feel that the answer is making it more market-based. It is unregulated. There's no transparency, there's no competition, there's no attachment to the market at all, except for procedures such as LASIK surgery and some cosmetic surgery. All of the rest of medical is just based on a lack of reality, and that's why it's so out of control, partly.
So what if there were a site like Expedia that lowers your travel cost to lower healthcare costs? Is that what MediBid is, Ralph?
That's essentially what it is, Jennifer, absolutely. For example, any McDonald's manager can tell you how much it costs to make a Big Mac, but United Airlines can't tell you how much it cost to fly me from Houston to Nashville this morning. And the same goes for hospitals. They can tell you how much it costs them to buy, procedures, or not procedures, to buy supplies and stuff like that, bandages. They can tell you all that, but to do an actual procedure, they can't tell you to the penny how much it costs. Now, if healthcare were more like travel, when the pricing would be based on the demand, the supply, and the vacancy rate, then we would have something more that was based on something sustainable, and then we would have competition.
So let's talk about these three different groups that we're addressing today: the healthcare providers and facilities. We have the patients, who on MediBid you call seekers, because we're seeking healthcare bids, right?
Right.
And then you also have employers and companies who benefit from your services.
Correct.
So let's start with the patients, the seekers. What is in it for us as patients?
Okay, so the patients, the seekers, they're right in the center of the hub. They're the center of the wheel. There's only one person in the US, one person in the world that can control healthcare costs, and it's not the president, it's the patient. Because in negotiation, the power is with the person that has the ability to say no and walk away from the table. In healthcare, it's regulated by health plans, by state governments, by federal governments, by suppliers, providers, insurance companies. Everybody's trying to regulate it different ways, but at the end of the day, the only person that can regulate it is the seeker.
So essentially, what MediBid is doing, they're empowering seekers.
Yes.
People seeking healthcare services at more affordable rates. And the way you do that is through providers or bidders.
Bidders, yes.
Bidding on services.
Correct. So when the seeker says, I want procedure A, whether that's a knee replacement, an MRI, whatever that procedure is, they will come to our site and they will see what the average price of that is over the last 6 months. They will see what it is in their region, what the national price is, and what the best national price is. So they've got a bit of an idea of what they're bidding for. In healthcare, there are no signals for price. If you owned a gas station, on your way into work, you'd pass other gas stations and you would see their price of fuel. Then you'd be able to set your price, because you don't want to be $1 higher or $1 lower. In healthcare, those signals don't exist. There's a shroud of secrecy surrounding the actual prices and the actual discount that insurance companies pay. So the market-based solution is putting the power in your hands, where you know what you want, you know how much you're willing to pay, and if your health plan is paying, you know that if you get under a certain threshold, they'll actually waive the deductible and in some cases give you money back.
Okay, now I'm going to stop you right there because you mentioned a health plan. Let's explain to the viewers what the difference is between MediBid and healthcare providers, health coverage, and health sharing companies.
Okay.
So could you explain that, please?
Absolutely. We're not coverage. We are a facilitator that gets you quality providers doing quality procedures with good outcomes for the price that you're looking for. We can work with brokers and health plans to design health plans for your company that will dovetail nicely with MediBid and reduce the costs. The current medical system is based on PPO model or an HMO model or EPO. In one way, shape, or form, there's always a preferred provider network that you're expected to go in. Now, that network doesn't necessarily mean that those providers are more affordable than people not in the network. It just means that they're the people that we're going to sign the contract.
Let me stop you right there, Ralph. We had a conversation earlier about how a provider determines costs and how we're actually charged as patients. Mm-hmm. It's not necessarily by the doctor's experience level.
Correct.
Explain to the viewers how we're charged and how they might be able to save money by going with a much more experienced surgeon or physician.
Okay, so the first myth is that the more you pay, the better the quality of healthcare. That is completely wrong. In most cases, we have found an inverse correlation between cost and quality. The more you pay, the less the quality. Let me explain why. Let's compare two orthopedic surgeons. One of them does 500 knee replacements in a year. Very experienced, and he's in and out in half an hour. If he comes across a complication, he's seen it before, it doesn't even slow him down. Now, the costs are based on 4 inputs: the surgeon fees, time in the operating room, which is billed in 15-minute increments, time under anesthesia, and number of nights in the hospital. Now, with an experienced surgeon, half an hour OR, half an hour anesthesia, it's very simple. An inexperienced surgeon that might only do 6 or 7 of these procedures in a year might take an hour and a half or 2 hours. So you've got more time in the OR, more time under anesthesia, more potential for complications. You are open for longer, more chance of infections. And because you've been under anesthesia so long, you might have to stay a night or 2 in the hospital. So it ultimately costs you more to have an inexperienced physician performing the procedure.
Okay, now a very interesting thing about MediBid is, as a seeker, I can research and vet my provider, and I have my options are limited. I'm not bound by state lines. I'm not even bound by the United States because you operate internationally. Exactly. Could you touch on that, please?
Yes. We have providers in 14 countries. We have patients in 70 countries. Now, there are some countries where we don't look for providers in. Okay, we don't look for bidders in some countries. It just doesn't make sense to. Travel restrictions, et cetera. But in the countries that provide very good quality care, and they are regulated and inspected and they meet certain safety standards, we recruit providers. Often you can save money by going to these because they specialize in certain procedure or because they just have really good expertise and practice, and often facility charges are less overseas.
So what MediBid is essentially doing is no longer is a patient or a seeker bound by their insurance network. You're opening up the doors globally and encouraging what's known as medical tourism. Could you explain medical tourism, please?
Absolutely. Medical tourism, there has been medical tourism in South America with cosmetic procedures for a very, very long time. A lot of people have been going to South America, Brazil mostly, for cosmetic surgery. There has been medical tourism in Mexico, in Thailand, in Korea, many countries throughout the globe, just sort of emerging, just sort of starting to develop. What their points that they make for medical tourism is primarily we have the same training, we have the same equipment, but the costs are lower. and that's often very true. The labor to construct a hospital, for example, could be substantially less. That leads to lower costs.
So, Ralph, even with travel to another state, perhaps, because costs could differ between state lines or across state lines,
Yep.
or to another country, the final bill could actually be thousands of dollars less to the consumer
Absolutely.
than if they were to just stay in network and go with the doctor their PCP recommended, referred them to.
Correct. I remember sending a patient, I shouldn't say sending because he made the choice. He lived in Chicago and he needed a colonoscopy. He went to Portland, Oregon for his colonoscopy. In Chicago, the best price he could find was $3,500. In Portland, Oregon, he got it at that time for, I believe it was $500 or $600. Even after he paid for the flight, the hotel, the accommodation, and the car, he still was a couple thousand ahead.
That is all so fascinating. So tell me, Ralph, how did you have this idea for MediBid? Where did that originate from? How did you say, you know what, I think I want to create a medical bidding platform? How did that start?
Well, that's an interesting story, Jennifer. I have been negotiating and bidding since I was about 5 years old. When I was 5 years old, I lived in Thailand and I actually negotiated a cab ride on my own in the city of Bangkok. So when I bought a car, I decided exactly what I wanted and I faxed the specs to 18 dealerships and I said, what's your price on this? When I buy a TV or computer, I look at Lenovo, I look at Dell, I look at HP, I look at Surface. I look at different brands and I compare the quality. So I do that as a consumer. And then I said to myself, why don't we do this in medical care? And my background as a healthcare consultant, I saw the big divergence of prices from the median price to the high price that was sometimes 3,000% with no increase in quality. As a matter of fact, often a decrease. And I said, we have to apply some market principles, some market economics to healthcare to get the prices down and to make them sustainable.
That is so fascinating, and thus MediBid was born.
Right. Well, let me give you an example. Let's say you had 50 gastroenterologists in the US. It would probably cost you about $25,000 to get a colonoscopy. You'd wait 2 years. Everybody at medical school would talk and say, hey, don't be a plastic surgeon, don't be an orthopedic surgeon. These guys are making a lot of money. Let's change. All of a sudden, 4 years later, you'd have 250,000 gastroenterologists. And the wait time would be 1 day, and they'd be doing it at the Minute Clinic for $250. So the economy works to fill a void. When there's high demand and low supply, the economy works to fill that void and equalize prices. That doesn't happen in medical care in this country, Jennifer. It just doesn't happen. So those are the principles that we use to inject into the medical system to make it more competitive and sustainable.
And MediBid really benefits, like we touched on at the intro, 3 different groups. You have your seekers, the people seeking healthcare providers
Yes.
for specific procedures. You have the facilities and the medical providers. And you have
Right.
employers and companies who
Yes.
MediBid benefits. Tell me how you're filling the gap for the providers, for the bidders.
Okay, so for the bidders, everybody has different desires, different needs, and they have different vacancy rates. After the pandemic, a lot of elective procedures were canceled. Some hospitals were filled with COVID patients, but some weren't because they weren't equipped to be, so they just had empty beds. Coming out, there is now a pent-up demand. Somebody that needed a knee replacement 2 years ago, some of them might have found a workaround through painkillers or therapy or whatever, but others, it's gotten worse. And other problems have developed as well. So there's a lot of demand now. So for the providers, instead of getting paid under the traditional insurance model where you bill a certain price, you get a discount, then you have to collect a deductible from the employee, and then you have to fight over what's left, they get paid at the time of service directly, okay? So they benefit that way. A lot of hospitals and doctors in the US and overseas for that matter like the medical tourism aspects. In Houston, we've got some incredible hospitals that bring in people from all over the globe to get medical care, as they do right here in Nashville with Vanderbilt. There are a lot of facilities that have that name that like to bring people in, so they benefit by that too.
And what you mentioned earlier was that certain countries and certain cities actually specialize in certain procedures. And because of the specialization there, they provide better service at a lower cost.
Correct. Specialization creates efficiency, which creates cost savings. And in some areas, sometimes it's government sponsored by a city or a state or a country where they say, let's spend a lot of money developing such and such a technology. I'll give you an example. In Japan, I think they were one of the first ones to come up with a really high-tech imaging machine that wasn't available in the US. They came up with it first, then Korea had it, and then eventually it came here. So sometimes a government-sponsored or led initiative can create innovation and change in that space. And that doesn't happen just in the US. It happens a lot in the US, but this is not the only place.
Could you give me an example of how this platform looks and works for a seeker?
Okay, absolutely.
What's the process?
The process, if you are working for an employer that uses MediBid as part of its health plan, you've already got a profile. You just log on and activate your profile. You decide what you're looking for, and I'll use the example of a knee replacement. Right away, we're going to show you what our average price is in the region, nationally, etc. You're going to know from your health plan administrator how much your plan will pay. You can go to any doctor and the plan will pay that amount to any doctor you choose. So when you're searching for doctors, you can reach out with those parameters. You can say, here's my budget, just like you do when you're buying a car or a TV. Then when you look for the provider, you look at their profile, which shows their quality, their outcomes, how many procedures they do per year, and where they're located and what their cost is. Often, by picking one that has a cost that is at or less than the plan will pay, you have a chance to get waived deductible, which for a lot of people makes the difference between having the procedure and not having the procedure, or having the procedure and still being able to send the kids to college, or having the procedure and not being able to send the kids to college. So that all becomes part of the equation, and we start to make healthcare decisions that are now rational.
And as a seeker, I have the opportunity through MediBid to research and vet multiple providers at my fingertips.
Absolutely.
How does that look and how does that work?
Well, it looks much the same as if you're shopping Amazon. You can read other reviews of people that have used the products. I know when I shop for a computer, I just recently have shopped for a computer, I looked at reviews. Some people said, it's not that fast, it's pretty slow, the battery runs out quick. Okay, I'm gonna go away from that one, I'm gonna go here. For the seeker, it's much the same. The surgeon, first of all, you find out how many procedures they do per year. The hospital, is it a good quality hospital? Do they have low infection rates? What are their outcomes like? So you get to see all of that in advance. Most people going through the traditional health insurance, all they see is this doctor's in network, this doctor's out of network. And that's pretty much it sometimes.
And what's MediBid's process, Ralph, for vetting providers when they want to join the network?
What we do is, the first thing we do is we look up their medical license with their state licensing board, their state medical board. We make sure they're in good standing, there are no current complaints against them. We look at some of the rating sites, Health Grades, Leapfrog, et cetera, some of the commercial sites out there. We look at the Medicare rating system when it's available. And we look at all of those sites to make sure that the doctor is licensed, in good standing, no disciplinary action against them. And we do all that before we allow them onto our platform.
So seekers can shop in confidence, so to speak,
Correct.
on MediBid.
Correct. We still caution them to check the doctor before they go, because something could have changed in the last year.
Of course. What's the process, Ralph, for providers who want to join the MediBid system, who want to make themselves available to bid on services?
Okay,
procedures?
so what the providers would do is they usually put in, they can start a profile. They won't be approved until we vet them, but they can log in, create a profile, and start putting it in, and then somebody from our provider relations department will reach out to them. They'll check them out in the background, and then they'll reach out to them, and they might say, hey, listen, you're in a great area of the country. We have a lot of people that need knee replacements in St. Louis, for example.
Okay, what's the time frame of approval essentially? So I'm Dr. Jennifer and I want to join the MediBid system so I can bid on procedures to help more people.
We usually get the doctors approved within a week.
Okay. And is there a cost for the providers and the facilities?
For the providers and facilities, there are two ways. One is just a straight annual registration fee, no matter if you get one patient or 1,000 patients per year. That is the most traditional method of doing it. Sometimes if we're really short for a certain specialty in a certain market, we will give you an introductory period where it doesn't cost you anything.
And is there a cost for seekers to access the MediBid system?
We have two financial models. One of them is where they just pay and then they make a request. And it doesn't matter if it's for a $300 MRI or an $18,000 knee replacement. One price, one bid. The alternate model is where they register and they have to pay to activate their account, a very, very small fee. Then when they get a bid that's acceptable, we would charge an administrative facilitation fee, which is much smaller for a smaller procedure such as an MRI CT scan, and a little bit higher for a procedure that might be $20,000, $30,000, or $50,000.
Okay, let's talk about employers and companies who might want to access MediBid. Is there a cost for them?
Yes, there is. Our most traditional model is where they pay depending on the scope of services they want and how large they are in terms of number of employees. We charge them a certain dollar amount per employee per month. Some of them want additional valet sort of concierge service. Some of them simply want access. Some of them want us to call their employees and walk through their health plan and help them make health choices. So that all comes into the equation when we're determining that. Other employers simply pay us a percentage of the savings, and we'll use a standard benchmark and we'll say everything we save you will charge you, say, 20-25%.
Could you give me an example, Ralph, of how MediBid benefits employers and companies? I know you had some numbers earlier.
Yes, yeah. Well, we have a couple that come to mind. There's one which was a company with about 450 people, 200 in the US, 250 or so overseas in 70 countries. Their health costs were set to go up to $6 million this year. We reduced their cost by $1.5 million.
That's
so
significant.
Yes, very significant. And all by just restructuring their health plan and giving them more choices.
That's fascinating. Let's talk about prescriptions and how MediBid can intervene and provide more options for prescriptions, because that's a huge cost.
It's huge, it's huge. Some health plans pay up to 25% of all their health costs on prescriptions now. Some health plans actually pay more for drugs than they do for facility fees. It's gotten to that breaking point. So prescriptions can be hugely expensive. We have some pharmacies that will actually bid on the medicines. Some of them are based outside of the US, some of them are based inside of the US, but all of them are such that they make sure that the drugs are quality, they're not counterfeit, they meet FDA requirements, they're FDA approved, but often we can save tens of thousands per prescription. There's one case that I remember, there's one case that is just coming to my mind where we saved a client $280,000 a year on one drug. $280,000 on one drug.
Wow. Now, to that point, perhaps a seeker, a patient, doesn't have a specific medical procedure they need bidded on. Perhaps they have a cabinet full of prescription medication that they would like to get their costs lower on. Could they go to MediBid for that?
Yes, they
Okay.
can. Yes, absolutely.
And how would that cost look? Would the process be the same?
The process is pretty much the same. They have to have a valid prescription, obviously.
Okay.
And they put in, let's say they want a Lipitor, for example, for high cholesterol. They would simply put in a request for that. They would have to provide proof that they have a prescription and send that in. And it's just like a mail order pharmacy where we will search out the best cost and get that prescription to them.
So a person's prescription wouldn't come from, just hypothetically, a Walgreens or a CVS or something like that, or an Express Scripts. That's a mail-in prescription service. Mm-hmm. It would come from the best bidder.
Sometimes
how does that work?
Yeah, this country we have what's called PBMs, pharmacy benefit managers. They source prescriptions from different drug manufacturers. Some of these drug manufacturers pay rebates to the PBMs. Some of the PBMs pass these rebates on to the clients, some don't. Some claim to have lower administrative costs, but they take the rebates, whereas others pass them on and have slightly higher costs. So we allow all of them to participate.
You benefit employers, mm-hmm. but you would like to speak specifically to a certain group of employers today.
Yes.
What is that group?
It's interesting, Jennifer, that you should ask, because we have a relatively sizable segment of our client base that are Christian employers. Some of them are churches, some of them are groups of missionaries, Christian schools, camps, etc. Some of them are simply Christian CEOs that own companies. We have developed specific programs for them, part of which includes healthcare sharing. We incorporate that as part of the health plan. It's usually not the only option, but it gives them an option to have something which they feel is more in line with their biblical beliefs. So we've developed specific programs for those employers.
Could you give me an example of how that works?
Yes. Under the Affordable Care Act, every employer with 50 or more full-time equivalent employees has to offer minimum essential coverage or pay a fine under the ACA. We have developed products that meet that standard but cover primarily preventive care. And the healthcare sharing sits on top of that. So it doesn't duplicate, it doesn't overlap, it sits on top of it. Then the people that want to take advantage of healthcare sharing can jump into that. Those that don't can get another major medical insurance plan on top of their preventive care, or we always have the other option that's the full major medical plan as well.
Okay. Let's talk about how MediBid is not healthcare insurance, it's not healthcare coverage, and it's not a healthcare sharing plan.
Correct.
Let's talk about how MediBid complements these things, but it's not something to stand instead of these things.
You know, it's interesting, Jennifer, because when you start looking at the actual medical costs, you actually realize that not everybody, but a lot of people can actually afford a lot more paying cash than they thought they could. Now, that doesn't mean we replace medical insurance, but we put it more into your hands of affordability. What we do is we vet the providers for quality and outcomes, and then we allow them to bid competitively. So getting you that competitive price where you don't have to call all across the country. There are some platforms that show you different prices, but 99% of them are based on a 50, a 75, a 100-mile radius. So it's just based on proximity, whereas we remove those boundaries and we allow people to look for medical care in different states or different countries. So having that competitive environment will really make them competitive, and it really gets the prices down.
Let's talk about the services that MediBid covers. And I want to hone in on mental health, because post-pandemic, that's a big deal.
Yes.
That's a huge issue where a lot of people are seeking coverage, and many mental health care providers are slammed in their waiting list.
Right.
So does MediBid fill the gap and tear down barriers to where people don't have to wait as long for coverage, specifically for mental health? How does that work?
Well, during the pandemic, a lot of hospitals shut down for elective procedures. And even doctors' offices were restricting the number of people that could come in, and they were trying to see people virtually, whether it's on a Zoom video call or just a phone call. Mental health providers were a huge part of that market, where they discovered, some of them already knew, but they discovered we can do a virtual call on FaceTime or Zoom and really get that interaction, because just on the phone with just the voice, it's just not the same. But having that face-to-face interaction, so you could see if the person's distressed and better able to help them. So we've seen a huge growth in virtual mental health consults.
However, there are limitations for mental health because of the in-state requirements.
Correct. There are licensure requirements. If you are a mental health provider in Texas, licensed in Texas, and you're talking to somebody in Texas, whether it's Houston to Dallas, or it doesn't matter if you're in the same city, but if you're licensed in the same state where the patient is, you're good. If you are in Florida and you get a call from a patient in Texas, you might have a Texas license as well as a Florida license, in which case you're also good. Some states require that the practitioner sees you in person before you can provide virtual consults and virtual medicine. So there are some state limitations, but the providers are all familiar with those when you call them.
But that's the only type of service where a seeker would be limited to staying within their own state. Is that correct?
Yes and no. I mean, if you're going for a knee replacement, that's not going to be done virtually. You're actually going to go to Phoenix or Orlando or Houston. So you're going to go where that doctor is situated and where the doctor is licensed, okay? Now, technically, I guess he could travel to Nashville to see you, but then he would have to be licensed in Tennessee. And generally, for procedures that are physical, hands-on procedures, you're going to travel to them. Whereas virtual consults, you're basically talking over the phone and or video calls.
So within MediBid, your system, how do virtual consults and telehealth work? Is that a possibility for people now?
Yes.
To tear down essentially walls, barriers, limitations to
Sure. Yeah.
who they see you?
Absolutely.
Okay.
We have mental health providers and telemedicine providers that you can access, whether it's for just one appointment or for a series of appointments. And once you establish that relationship, you can continue on with them. Some of them sell memberships whereby you can have X number of visits per month or sometimes even unlimited, whereas others have a single case rate.
We're talking a lot about specialized procedures today, but does MediBid also meet a need for regular everyday care and to have a bid on that as well?
We don't do a lot in terms of primary care,
Okay.
simply because the savings would be $20, $30, $40. It wouldn't be a huge amount, and there would be a far distance to travel. Sometimes it's not worth it for the doctor to register, sometimes it's not worth it for the patient. Now, having said that, if you're on one of our employer-sponsored healthcare and it's a covered service, then yes, we can absolutely help you find a doctor for that.
But what would you say you specialize in, Ralph?
Some of our most common procedures are orthopedics, high-tech imaging, colonoscopies. Those are probably our three most common procedures. We're doing more and more cancer as well. We're doing some heart procedures, general surgery we're doing a lot of, and spine surgery.
And cosmetic surgery?
We're doing some cosmetic, and I forgot to mention the prescription drugs, of course.
Yes.
Yeah, cosmetics, also some cosmetic dental. Not a lot, but cosmetic surgery, yes, we do some of that as well.
Ralph, I have a question.
Okay.
As a seeker, when I go on to MediBid,
Right.
am I loading a specific problem to be bid on, or am I coming to you with a referral from my primary care physician? How does this work?
It could be either or. Your primary care physician could have sent you for an MRI, X-ray, etc., blood work, looked at it and said, yeah, you definitely need a knee replacement. It's bone on bone, okay? You could have even gone to an orthopedic surgeon and that same thing could have happened, and then you know you need a knee replacement, okay? That's one way. Then you're only shopping for the procedure. But sometimes you're really not sure. You know, my knee hurts, it's hurting worse and worse. I can't run up the stairs, I can't kick a soccer ball. You know I've got something. I don't know if it's arthritis, you know what it is. You're not comfortable going to a search engine to Google, so you basically are asking for a second opinion. You might even say, I think I need a knee replacement, but I'm really not sure. Now, if you have an x-ray, you can upload that x-ray to our portal. You can upload any doctor's notes. And what you get the benefit of is hundreds of thousands of doctors potentially being able to say, hey, you know, I've looked at the x-rays and it's not bone on bone yet. So therefore, I think procedure A is better as an intern step instead of procedure B, okay? Now, of course, second opinions are very interesting because Mayo Clinic did a study several years ago and they found that 88% of the time when somebody gets a second opinion, the initial diagnosis is overturned or modified and a different outcome, a different procedure is recommended. So you can either go right on for a second opinion, or by submitting your request, you're getting some second opinion input on that.
How does that work? How does a provider communicate with a seeker over the MediBid network? Is it Zoom calls? Is it Skype calls? Is it email? Are there chats within the platform? How does this work?
There is one-way communication. The doctor can ask the patient to upload more information. Now, if you're specifically looking for a second opinion, you've been told that you need or might need a knee replacement, but you want to verify that because you're not sure. You actually go to the category called second opinions, okay, and you actually submit it there. Some of our second opinion specialists will collect the medical records from your doctor, review them, and say, I agree with them, or I partly agree, but I think this is a better thing. Others will just do the workup right from the ground up, just from scratch. They might send you for some imaging, lab work, blood work, etc., and then they'll look at your medical records and give you some advice in terms of what you might need.
Ralph, how do physicians or their assistants go about bidding on procedures? Is there and being trained on the MediBid platform,
right.
Is there an onboarding process that your company takes them through?
There is. Our provider relations department will reach out to them and walk them through it. We encourage new bidders to upload a price list, if you will. Now, it's very hard to say, here's how much, for example, let's talk about something really complicated like heart or cancer care. It's really hard to say, here's how much for a triple bypass, right? It's very, very difficult. So in those kinds of cases, there usually would not be an auto bid or bid it now price. But for something more straightforward, they can actually put one. And they might set it a little bit on the high side. And then once that goes out, you see the buy it now price right away. But then as they look at your actual notes and you say, well, you know, I was just perfectly fine until 2 days ago when I stepped off the sidewalk and twisted my, oh, okay, well, in that case, whole different story. They might relook at it and change the price and change the procedure. So we will walk them through how to do that. Sometimes the weaknesses in the physician's practice, the person that they have managing that, because as you mentioned, it's usually not going to be the doctor themselves. It's usually going to be either a front office or a back office person. We like for it to be the practice administrator because they have more responsibility and they might delegate somebody to watch for it, but anything that goes out on their buy it now price, they've already gone out, then they just want to potentially look at the records and see if they have a second opinion on their own bid.
Because I could see how just the onboarding time, learning a new software, learning a new process would be a hindrance to why a physician wouldn't want to participate. It'd be extra manpower for them, extra hours. So how do you eliminate that and make this easy for providers and facilities?
The way we make it easy, we say, pick your top 10 procedures and give me your price. And just upload it, and then it can be just on autopilot after that.
Well, Ralph, I guess that just about does it. I am so honored to sit with you today and share with the world how you are revolutionizing how we are paying for and finding our healthcare providers. You're tearing down borders, and that's tremendous. You're lowering our cost and really empowering the individual with how they're paying for, reducing the cost of their healthcare coverage and procedures.
And
Amazing.
Thank you, Jennifer. I think that's the key. That is the key, empowering the individual, giving them tools that they didn't have before to allow them to shop for quality providers, whether it's in their state, across state lines, or in different countries, to pay what they want to or what their health plan will, so that they have minimal out-of-pocket costs with maximum benefits. In healthcare, as I said earlier, there are no price signals. We don't know what is the right price to pay for a knee replacement, for an MRI, for chemotherapy. We don't know that. Nobody knows that. Even the providers, a lot of the contracts have gag orders on them, so they don't even know what they're allowed to say, what they're not. It's all regulated by the insurance companies, the third-party payers. Any system where you have a patient or user of services, a provider of services, and then at the bottom you have the payer. It's a third-party payer system. It's like a V. There's no direct relationship between the patient and the doctor. Okay? The doctor has a relationship with the payer, the patient has a relationship with the payer, but there's a disconnect here. Okay? That cannot be sustained. So what we do is we put the patient at the center, and we turn the V upside down so that the patient is here and the payer's here and the doctor's here, and there's even a relationship here. So we triangulate that relationship, and that's what changes the dynamics. That's what changes the economics of healthcare.
It's really bringing smart economic policy to healthcare, which has been missing.
Right, absolutely. I mean,
capitalism will always win.
Competition, transparency, absolutely essential in any transaction. We have some of the highest healthcare costs in the world, but not the best outcomes. And a lot of our system is based on huge amounts of bureaucracy and complications in the way that providers have to bill, the way the insurance companies pay, the way they collect a certain amount from the patient based on a whole bunch of different factors. It's gotten very, very complex. So we're trying to simplify it and apply some economic principles.
I would even argue, Ralph, that it's not only complex, it's convoluted.
That too, absolutely convoluted.
And so you're really simplifying the entire process by bringing this bidding platform to our healthcare, not only the services, but also the prescriptions, which is a huge expense out of pocket for so many Americans. Well, citizens of the globe, because it is a global company now.
Absolutely.
So.
And the answer is simple: uncomplicate healthcare.
Thank you so much, Ralph. I appreciate you. If you would like to sign up for MediBid, which you should, please visit www.medibid.com. Register today, lower your costs, and let's transfer the power back to the people.
Thank you, Jennifer, for having me. I had a great time on the show. We talked about a lot of interesting things, and whether you're a provider, a patient, or an employer, we might have the solution just for you at medibid.com.